Hey there, it's your favorite aesthetic dermatologist, and in this session of Ask Dr. Kirby, I'm going to be answering all of your laser hair removal questions. First question, is laser hair removal permanent? Laser hair removal offers a level of permanency. Typically, patients will get about an 80% permanent reduction in hair, and any hair that remains will be thinner, finer, and less dense. Now, some people get 90%, 95%, 99% permanent hair reduction, but hormones change things, time changes things, outside exogenous, SAT word, factors change things. So over time, some hair may return, but typically you get a significant permanent reduction with appropriate laser hair removal treatment. Does laser hair removal hurt, and do I need numbing cream? So laser hair removal is uncomfortable but extremely tolerable. And of course it depends on what part of the body is being treated, and it depends on the density of the hair. So as an example of an area that's very tolerable is the underarms. The underarms, well, women really don't want hair in that area, many men as well. And if you get hair removal treatment there, very, very tolerable. Just doesn't hurt very much at all. Not a lot of neuronal density there, so great toleration. In the genital area, if I'm being more specific and a little graphic, well, of course, that's a more sensitive area, so it does hurt a little bit, but still very, very tolerable. And typically we don't use numbing cream at all because most people don't need it with modern technology. So does it hurt? No. Is it a little bit uncomfortable? A little bit, but still very, very tolerable overall. How many laser hair removal sessions do I need? Well, this depends on the individual. And there's a huge genetic component to it. There's a gender component to it. There's a hereditary component to it. Dark, thick, dense hair, well, you may need an extra session or two. But very typically speaking, on the body with 6 to 8 sessions, we can remove about 80% of the hair permanently. On the face, well, you might need about 8 sessions because again, that hair is denser, it's darker, it's more prone to hormonal changes. So 6 to 8 sessions as a general rule is how many treatments you need for permanent hair reduction. If laser hair removal is permanent, why do I need a maintenance treatment? So most people get a level of permanency with laser hair removal that's really an outstanding clinical outcome. Sometimes people may need a maintenance treatment, and a maintenance treatment might be needed once a year or maybe never. You may never need a maintenance treatment. What happens with maintenance treatments is androgen exposure, which is sex hormone exposure over time, can cause some hair regrowth. So if you get laser hair removal very, very early in life, well, when you get into your 20s and 30s and you have hormonal changes, that may cause a little bit of hair growth and you'll need a maintenance treatment or two. Or with birth control, getting pregnant and having a baby, sometimes breastfeeding, different hormonal changes in your life will cause androgen exposure, and that little bit of exposure may require a maintenance treatment. Again, many people don't need a maintenance treatment at all, and if you do need a maintenance treatment, once a year or every couple of years is all you'll need. Is laser hair removal safe for darker skin tones? Absolutely. Modern laser technology is 100% safe for darker skin tones. So if you go to any laser way in the country, you're in good hands. What device specifically? Well, it's a wavelength of light. It is a 1064 nanometer wavelength of light from a long pulse ND-YAG laser. Some devices are not safe with laser hair removal for warmer skin tones. That would be an IPL device or a diode laser. But the technology that we use at Laserway is of course safe for all skin tones and types. Is there downtime after laser hair removal? There is very little downtime after laser hair removal. Now, of course, you could have a little bit of folliculitis because we are irritating those follicles by sending energy in there to zap them and kill the stem cells. But as an overall rule, an overarching concept, very, very little downtime. So little folliculitis, little bit of itching, maybe a little bit of swelling, maybe a little bit of redness, usually not, but that can occur. It's very, very treatable, and the downtime with laser hair removal is extremely minimal. What areas can you get lasered? We treat from the rooter to the tutor. Not an SAT word, but very sincerely, we treat it all. People call me all the time. They say, hey, Dr. Kirby, don't repeat this, but I want to get this blank part of my body treated. And I said, we treat it all. And they're like, aren't you guys embarrassed? No, this is what we do all day, every day. So come on in, have a conversation with a clinician. We keep it 100% professional. We'll close the door, make it very, very comfortable for you, and then we will treat any and all areas of your body. Is there anything I need to do before getting laser hair removal? Well, the less sun exposure you have prior to the treatment, the better you'll do because we can be a little more aggressive with our energy settings. So we ask that you avoid the sun 2 weeks before the treatment. Some areas of the body that's very easy, like the underarms. Hopefully you're not out tanning your underarms, or an intimate area. Hopefully that's covered. But if you're getting treatment, on your legs or somewhere, your arms that's going to be sun exposed, again, we ask that you use sun protection 2 weeks prior to treatment. It's also important that you shave about 12 hours before you come in. See, we want the hair just at the surface of the skin. That allows us to impart energy and go down the hair shaft to the hair bulb to destroy those stem cells and give you permanent hair reduction. If the hair is too short, meaning you wax it or tweeze it or pull it out, well then we can't access the stem cells via the bulb. Conversely, if the hair is too long and you haven't shaved, well, too much of the energy gets caught in the hair shaft. So again, no tanning 2 weeks before, avoid the sun 2 weeks before, and shave 12 hours before you come in for your laser hair removal treatment. What should I look for in choosing a place to get laser hair removal? This really comes down to two elements. One is technology and two is experience. Whenever you're getting any medical treatment, well, of course you want the person to use the appropriate technology. And you want to make sure that the right laser hair removal is being used when you're getting laser hair removal. But even more importantly is experience. You want to go to a clinician who knows what they're doing. A clinician is a registered nurse, a nurse practitioner, or a physician associate. And again, experience is all what it comes down to. No one has more experience with aesthetic procedures than LaserWay. We do tens of thousands every single month, and you're in really good hands when you go to a place that has the highest quality policies, procedures, protocols, coupled with their technology and experience. So that wraps another #AskDrKirby session. But it doesn't have to end here, because put your questions in the comments section below and I'll try to get to them in the future. Remember to wear your sunscreen. Dr. Kirby out.
Ready to be a laser babe? 3 steps. 1, subscribe to our channel. 2, watch more amazing videos. And 3, schedule your free virtual consultation for any of our services by clicking the link below. Then we can be friends in real life. Bye.